Assalamu alaikum warahmatullahi wabarakatuh. My name is Ahmed Al-Huwaidi, Assistant Professor of Psychiatry from Al Jaffa University. I'm happy to present for you the mental health impact of pandemic COVID-19 crisis on university students in Saudi Arabia and associated factors. This paper was published by Dr. Ahmed Al-Hadi and myself at Journal of American College Health. The new COVID-19 pandemic has multiple effects and lead to general lockdown, disturbance in lifestyle, closure of work, financial difficulties, and socialization. Despite the COVID-19 make our planet to breathe, but also have effects on general public and mental health. On systematic review done, uh, reported traumatic stress disorder from 7 to 54%, psychological distress from 34 to 38%, and the stress itself from 8 to 82%. This done among general population in China, Spain, Italy, Iran, United States, Turkey, Nepal, and Denmark. We aim in our study to assess anxiety, depression, and stress among university students in Saudi Arabia and its associated factors. We collect 5,140 participants from Saudi University for cross-sectional study. We ask them to do some demographic questions. Then for depression, we choose to use BHQ-9, for anxiety JAD-7, and for stress BSS scale. This done, our data collected from 24th to 30th of April 2020. We found that 81% of our sample was female. The mean age was 22 years old. 41 had significant symptoms of anxiety. 49% has significant symptoms of depression, and 87% have moderate to high perceived stress. Being a female, younger age, living in Eastern region, and relative or acquaintance with COVID-19, chronic medical or mental illness associated factor with high level of depression, anxiety, or stress. In BQ9, there is item number 9 asking about suicide and death wishes. We found that 6% of our population has suicidal thoughts or death wishes. This means 300.7% of our students we calculated they have suicidal thought or death wishes. About 41% of our sample showed moderate to severe anxiety symptoms. This is clearly higher than the anxiety level in similar study with the same assessment tool, which was conducted a decade ago, where anxiety prevalence was 14%. Also, we found that 49% of our participants have significant symptoms of depression, which is double of same or similar study was conducted a decade ago for the same population. The lifetime prevalence in Saudi Arabia for depression is 6% only. Moderate to severe stress level was 87%, which is a very high number. If we compare it by similar study done in 2014, which present anxiety as 48%. We conducted our study during the exam season, which may play a role. So, COVID-19 pandemic negatively affected the mental health of university students. Quick and effective intervention are mandatory. We will finish by take-home message. كلمة الأمير محمد بن سلمان حفظه الله: ثروتنا الأولى التي لا تعادلها ثروة مهما بلغت، شعب طموح معظمه من الشباب وفخر بلادنا وضمان مستقبلها بعون الله. So let's start take care of mental health or university students. Thank you.